things coming in media, and many experts at government level, pediatricians, all bodies are giving opinions. So I thought I will clarify these things just by clarifying those questions which I am receiving from parents. So remember, whenever we are talking about immunization, in a private pediatrician and hospitals follow Indian Academy of Pediatrics schedule, that is IAP schedule. This is a apex body for pediatrician, and the policy and the vaccines come up with the recommendation by experts, and periodically it gets reviewed, maybe every year or so. That's why you will find that many times something we have printed on our vaccination card, but we are following something else because the card we have printed maybe the year before, and this year the policy changes. So we have to keep on updating. But there are other vaccination programs also run by Government of India, which is Universal Immunization Program, or what they call it, Mission Indradhanush. So there is some difference in these two immunization programs. As I said, the schedule, sorry, that was after 2018-19. There has been update also recently. So this is the Indian Academy Pediatric schedule. So a baby who's newly born gets, while in the hospital before discharge, gets oral polio drops, the BCG injections in arm, and hepatitis B, first dose of the hepatitis B vaccine in thighs. So at 1.5 months of age, baby is administered hexavalent or pentavalent, a combination vaccine that covers diphtheria, tetanus, pertussis, polio, Haemophilus influenza, and hepatitis B. So that's what it contains. And then we give a separate injection of pneumococcal vaccine and oral rotavirus drops. So this schedule is followed at 10 weeks as well as 14 weeks. And then here is the difference. At 6 months, influenza vaccine is recommended. So there are 2 dosages, 4 weeks apart or 1 month apart, of influenza 1 and 2. At 9 months, we give MMR or measles. And typhoid vaccine can be given anytime. So you can club typhoid vaccine at 6 months dose, 7 month dose, 9 month dose, or 12 months. That's why there will be variation. Few pediatricians will be given at 9 months, some will be given at 7 months. So because it is allowed to give any time between 6 to 12 months. At 12 months completion, we give hepatitis A. So hepatitis A is a waterborne hepatitis. So contamination of food and other things. So better to be given at 12 months. And then at 15 months, we repeat the dose of MMR. We give chickenpox vaccine and the booster of pneumococcal vaccine between 15 to 18 months. At 18 months, what we give is another booster of the same hexavalent vaccine and hepatitis A second dose. And around 5 years, again, you have to give the boosters of all these 3 vaccines, varicella, MMR, and hexavalent ones. And at 9 to 12 years, there is another booster of same thing, tetanus, diphtheria, and pertussis. And then human papillomavirus. Why I'm telling this? This is the primary immunization recommended by Indian Academy of Pediatrics, and it does contain and recommend flu vaccine as a primary vaccine. Okay? So that is irrespective of the pandemic or not. And the government or UIP is a little bit different, and it did not mention these vaccines. Now, coming to influenza, because the special focus is now on influenza in COVID pandemic. Why? Because influenza, there are two varieties, and it mainly presents like a flu, and mainly in winter. But there are climates where there is no obvious winter season, or winter is not very harsh, or what we call temperate climate or tropical countries or areas. The incidence of influenza is higher during rainy season, monsoon, or post monsoon. So that's what one has to remember, especially when you are living around Mumbai and coastal areas. So influenza can affect both adults and children, but children are more vulnerable because their immune system is still developed. So as we know, what is common flu or viral is influenza most commonly. Symptoms are runny nose, cough, fever, sometimes vomiting, headache, body ache, muscle pain, weakness, lethargy. All these are symptoms of influenza, but most patients recover with supportive treatment. We just need, like any other viral infection, you need paracetamol, as well as you just need an additional adequate hydration. Because if you are having dehydration, then all these things may cause. What are the age groups where influenza can cause severe disease? So children between say 6 months to 5 years, they are at increased risk of having influenza and severe influenza, uh, mainly because their immune system is still evolving. And children with chronic problems such as conditions of heart, lungs, so it includes asthma and previous history of repeated pneumonias, and also those kids who have got long-term muscle weaknesses, what we call myopathies. In these children, irrespective of their age, they always remain at risk of influenza and having severe. Few immunocompromised children and preterm babies are at risk of influenza and having it manifest a little bit more severe than a normal. Influenza can cause ear infection, sore throat, uh, and pneumonia is variable. Sometimes you just get better with support, oxygen, or sometimes you need ICU stay or ventilator. But most of the patients have got mild disease. So, how to protect against influenza? So, the primary schedule is, as I told you, 2 dosages of influenza vaccine, 4 weeks apart, one at 6 months completed, and the second at 7 months of it. Thereafter, what we need is yearly booster till 5 years of age. And in certain high risk group, which I previously mentioned, you need to support them till they are 18 years. If you are giving this vaccine for first time, then in children who are aged more than 9 years, or same schedule is followed for adult, you just need single dose. You don't need 2 doses. The preferred time for administration in this temperate climate is before the onset of monsoon. So that is between April to June. So because this virus has got properties to change its surface uh, and cause mutations, uh, that's why every year the strain changes and the vaccine also is changed, so that we can cover all those strains. So uh, usually for temperate climate, you will have the vaccine ready by end of March or April. So how effective is influenza vaccine? Overall efficacy is 60 to 70%, but its efficacy is better for reducing severe disease and hospitalization. So, like nowadays, we talk about COVID and how it is more effective in preventing severe disease rather than just mild disease. Kind of similar thing you can say about influenza. It's not that you get vaccine, you are not going to get influenza. It's not true. You may get it, but the severity will be less. And as I said, yearly vaccination for this reason is recommended. The vaccine is generally well tolerated, and sometimes you can have mild fever or myalgia, but with lot better tolerated. Definitely, paracetamol, as compared to what the baby had during the 6, 10, or 14 weeks immunization, influenza vaccination is not at all a concern and it's tolerated quite well. So, why is so much focus on influenza vaccine? The reason being, both COVID virus as well as influenza, they affect respiratory tract, so lungs, throat, nose, and both viruses have similar kind of presentation. Like both will cause cough, fever, breathlessness, running nose. So when a child presents with this, it is really not very easy to differentiate uh, COVID from influenza. Right now, we are not saying many influenza cases, and we have a history of other parent having COVID. But later on, as the adults get immunized, we may not get that history. And when the child comes to you with these symptoms, it will be very difficult to differentiate just by examination and history. So we will have to end up sending RT-PCR for COVID as well as the nasal swab also for influenza virus. Actually, even though now everyone is aware about the nasal swab, but that was initially used for these viruses only, influenza, which we did during previous influenza pandemic. And then what happens if we give influenza vaccine? At least there is some protection against influenza, and we can be assured that this, at least we are not dealing with influenza here, and we can go ahead and presumption. We can go under presumption of COVID management because COVID vaccine is still not being licensed for use in children in our country. So we'll have some time to catch up with that. So and while this monsoon weather now starts and also winter later in the northern parts of country, we will have increasing number of influenza, and we are talking already about this possibility of third wave and other thing. So during that time, it is going to be very busy. Hospitals and also healthcare, there is going to be a lot of activity going on. That is influenza vaccine giving to your children may avoid a hospital visit because at least we know that with reduced severity, we can get better influenza rather than visiting hospital. So just to summarize, that influenza or flu shots, they are recommended for children as a primary and influenza vaccination reduces the incidence of severe disease and hospitalization. It is advised for protection against severe flu, but remember, it provides no protection against COVID as such. Of course, there are studies going on and see what happens and what happens with these vaccines, but don't be under assumption that giving influenza vaccine is going to protect you against COVID. For protection of COVID, you still need for your children to wear masks, carry out proper hand hygiene, and social distancing, avoiding all those crowded places. That needs to be continued. But Why we are doing that? We don't want to take a collateral another disease which is going to make you go and visit hospitals or get investigated. That's where influenza comes. Yes, so that's what was mainly because this is mainly for flu vaccine. So if somebody has got more doubts, you can ask the question or just put in the chat box.